Kia ora, Healthcare Homes whānau, thank you for this opportunity, Jess. Really appreciate it. Look, the key points I'm going to cover this morning are my journey, my experiences of health services over a long period of time. Also cover what worked well for me and what didn't. Also going to talk a little bit about co-design and co-production and consumer engagement, which has been a lot of my mahi. But first I'd like to start with my mihi. He tangata o te tariti aho, ko Pakeha toku iwi, ko Wallace Sutcliffe toku mātua tūpuna no Lancashire, ko Alan toku whaia tūpuna, ko Bert Sutcliffe toku mātua, ko Norma toku mama, ko Gary Sutcliffe toku ingoa. E noho ana aho ki Waitakere, ki Tāmaki Makaurau, tēnā koutou, tēnā tātou katoa. So kia ora, my name is Gary Sutcliffe. I come from Tāmaki, Makaurau, Auckland. I'm married, 47 years this September. I never forget anniversaries. And we have 2 children and 5 granddaughters. So a little bit about me and my health journey. Apart from breaking my leg when I was 15 and spending 3 months in Waikato Hospital, very convenient because it was my first year of school certificate, first year of 3, I have to say. I had a very healthy life. I was fit and active right through my early 40s. My wife and I did our big OE in the mid-1970s, and 2 years after arriving home, we had the first of our 2 children. Throughout this time I played cricket and hockey, including a season with the Richmond Hockey Club based in Kew Gardens in London. In 1984, when I was 35, I went through a strange time when all was good on the surface. It was well at home, family and work fronts were all good, but I felt a bit lost and kind of empty. I saw my GP, who tried to tell me that I was going through a change depression. The thing was, I didn't feel depressed. In fact, what I realised then was, after being fully and actively involved summer and winter with my cricket and hockey, I gave them both away fairly quickly. I think I might have skipped one there somewhere. Yeah, I gave them both away fairly quickly because we moved from the North Shore to West Auckland, and I didn't realise the impact that this would make on me. So on New Year's Eve 1984, I made a resolution to run a marathon in 1985. It was like a shock horror. I was going to run a marathon. So that was a resolution that changed my life, had a major impact in helping me on my recovery from mental health issues in the years to come. In 1985, I left a relatively secure job at the BNZ and bought a business, a retail sports store. It was a big move. It entailed us selling our home to buy the business. The first 5 years were great. We loved the lifestyle, were able to maintain a good standard of living, bring up and enjoy our 2 young children. However, in 1991, after our business had stagnated and effectively was going backwards, the wheels fell off. I didn't know what was happening, I just knew I felt like shite, to quote Mrs. Brown. One day when I was in the store with my wife and my dad were there as well, we were doing a refurbishment of the store. I felt an overwhelming sense of panic, and I said to them both I just had to go. So I went home, promptly went to bed in the middle of the day, something I've never done before, closed my eyes and hoped I wouldn't wake up again the next morning. But wake up I did, still feeling horrible. After all, I had a business to run, which for the most part was a one-man band. I saw my GP, who was quite a stiff, serious, quite an aloof person. In other words, someone who wasn't easy to connect with or feel any semblance of relationship other than he was my doctor and I was his patient. He was a medical person. He was quite helpful, but very clinical. He did suggest I had depression, although didn't really explain what that was, and that counselling may be helpful. After a while, he did prescribe some medication, which, despite hope, didn't seem to work, and neither did counselling. He then said to me that he wasn't able to prescribe any stronger medication and said that he'd refer me to a psychiatrist. I remember thinking that that had to be the worst day of my life. Why on earth would I need a psychiatrist? They dealt with mad people, insane people who were institutionalised, because that's all I knew about madness. So a referral was made, and my wife and I went off to see the psychiatrist. I also learned the appointment was going to cost $200. This is in 1991, 30 years ago. Goodness knows what that would equate to today. And as we were struggling financially, that added to my burden. Fortunately, family members came to the rescue, enabling me to have 3 or 4 appointments with the psychiatrist. I wasn't to know it then, but this became a turning point for me. The psychiatrist, after the trial of one antidepressant for a week or so that didn't seem to make any difference, started me on nortriptyline. After a few weeks, I was getting better according to the doctor, even though I couldn't really see any light myself through the darkness. The gloom gradually started to lift, and after a while I could carry on working my business with some hope. I never stopped working in the business, but in the early months of my depression I spent most of my time out the back of the store, often in tears, hoping that no one would come in. And when a customer did come in, I tried to put on a happy face and hopefully make a sale, although I didn't really care whether I made a sale or not, which is a bit odd when you're trying to make a living out of having your own business. I just wanted to get back into my own space out the back. After 5 to 6 years of previously owning and loving and running my business and interacting with people, I found myself avoiding them as much as I could. I wasn't isolating, but it was as near as damn it as to swearing. That's what I was doing. I certainly wasn't going out of my way to mix with people. One of the first opportunities for personal growth and learning from my experiences was to help my psychiatrist make a video called Understanding Depression. This was made in 1992 and produced for GPs to show and give to their patients who presented with depression or depressive symptoms. I was one of 5 or 6 people from different walks of life and that had presented with depression and the different circumstances that led us into depression. In the late 90s, I started doing some voluntary work, initially as a trustee of the West Auckland Mental Health Support Trust, known as Te Ata, and I remained a trustee with them for the next 13 to 14 years, including as chair and with a couple of extended absences along the way. What I soon came to learn is that depression and recovery is not a linear process. During the 1990s, I experienced a number of relapses and recovery. Nothing was as bad as the first time, but difficult to deal with it. After 5 years of voluntary work, mainly in governance roles in the health sector, I realised that if I wanted to make a real difference in people's lives, I had to find work in the mental health sector. I was 55 at that time, when many people were thinking about retirement in the short to medium term. The first role I got was a consumer development leader for Framework Trust, an Auckland-based mental health NGO. From there I joined Connect Supporting Recovery, another NGO based on the North Shore, and 2 years later I managed the Auckland Regional Consumer Network for 3 years. After a gap, another relapse, I was approached by Pathways in Manukau to be project lead for a proposed consumer peer-run service in Manurewa. When that role finished, I felt almost ready for retirement. Then I met up with Dr. David Kadaya, who some of you in this room will probably know or know of, a psychiatrist working for, at that time, East Tamaki Healthcare in Otara. David and I were part of an external review team reviewing mental health services for a South Island DHB. Me as a consumer, David as consultant psychiatrist. It was while we were there and on the flight home that David talked with me about the mental health team at East Tamaki Healthcare and his desire to include peers or peer support specialists in his team of health psychologists and a practice nurse with mental health training. This was to be some of the best years in the workforce, some of the best years of my working life. And I was in my mid to late 60s, and I learned more ways in which the primary health sector could support patients with managing their long-term conditions, and particularly with their mental health. I had already trained as a peer support specialist 10 years earlier, and with East Tamaki Healthcare trained as a self-management facilitator under the Stanford Chronic Disease Self-Management Program, and as a master trainer, and later as a health coach. right at the beginning of the training of people that are now known as the health coaches. So retirement for me is a bit of a misnomer. I continue to work in the sector as coordinator for the Health Consumer Advisory Service for Health Navigator, as a consumer auditor as well, and of mental health and addiction service providers, and in governance roles in the sector, including my role with healthcare homes. And this was my last appointment, in fact, was with healthcare homes, collaborative, the council and governance groups. So what worked well for me in my experiences of the health system as a consumer stroke patient? The GP referral to the psychiatrist, it seemed like it was not the greatest thing. It didn't seem so to start with, but it did prove out to be a turning point. Finding the right medication. Having said that though, the psychiatrist didn't muck around, because I'd heard the GP saying it could take 4 to 6 weeks for this thing to start to kick, and I thought, I want this to work tomorrow. Anyway, she said, look, I will know within a week to 10 days whether this is having any impact at all. I had very good care by ambulance and medical staff following a heart attack that I had. It was excellent. And the procedure was all really good. I had a good CBT therapist who understood my journey. And on that note, I actually, because of my peer support training and other things, I thought I'm going to interview people to be my therapist. I wanted to make sure I made a connection with them. So I said, I want to meet with you. I didn't say I'm going to interview you, but that's what I did, so I could choose somebody who I related to. And I've taken up a number of opportunities as a consumer. Right? And having a patient portal was actually helpful. I only signed up for one during lockdown, having known about them for quite some time and never thought to do anything. But lockdown kind of forced that, and it's great. So what didn't go so well? There were no mental health support services in the 1990s. Or if there were, I didn't know anything about them. Some senior mental health staff didn't walk the talk when it came to supporting me or not during difficult times. We're talking about mental health service providers here, and taking me on board as a consumer with lived experience, valuing that experience but not really understanding when I was going through the tough times. My wife also had an experience with a very judgmental cardiologist, so it wasn't my experience, but my wife had a heart attack as well, and the cardiologist came in and sort of said, are you a smoker? And she said, no, I haven't. I'd smoked when I was in my early 20s, but that's it. And he said, oh, is that right? I can smell a smoker a mile off. And that really upset her. She had just had a heart attack, and he was saying, I know you're a smoker. So that, if it had been me, I know I would have been devastated. And she was too. She's a pretty tough lady, but that really hurt. The body language of GPs, some of the ones I've had, even the current one I've got, and I won't mention her name, but yeah, it's not a warm relationship. It's kind of, yeah, it's a bit patient-doctor, it kind of stops at that level. I'd like to talk about co-design and co-production and consumer management. I am, unapologetically, a huge fan for co-design. And if any of you have ever listened to or met Dr. Lynn Ma, who in my eyes is the guru of co-design, it's great. So look, it's been an interesting journey as a consumer representative, an advocate, consumer advisor. As a patient, I haven't been asked to do any of these things by my medical practice. However, I have taken many opportunities to contribute to co-design through consumer engagement. It's been in the mental health sector primarily that I'm particularly grateful for those people who offered me these opportunities. With regard to my own medical practice, which is not a healthcare home practice, there could be more opportunities for patients to contribute to their service and quality improvement beyond the suggestion box, which I doubt many patients would use. I've never seen anybody put one in yet when I've been in the waiting room. They did have an opportunity to engage with patients, input into the design of new premises that they're about to move into. I haven't seen the new premises. I didn't know about that apart from a friend telling me, did you know our doctors were moving next month to a new facility about 1 kilometre up the road? They could have, and I have heard, in fact there's some stories through healthcare homes of where the practice has engaged with people to say, look, we'd like your input. Anyway, so while on the subject of co-design, the best practice is to involve patients, people right from the start, before any plans have been drawn up, and to keep them, us, involved, informed throughout the processes of planning, implementation, and evaluation. That way the practice gets the best out of patient engagement because they get it from their view. This is what would work for them, but also makes the patient feel valued and contributing to that whole quality. Happy to answer questions. Kia ora. There is a difference, and in the last 12 months particularly, through a budget, I think it's something like $450 million that came out of the wellbeing budget for mental health, primary mental health. Practices have engaged health improvement professionals, health coaches and support workers. Some of them have all three, working in the practices. So a health coach often but not always comes from a lived experience back. They're not doctors, they're not nurses, they're not therapists. They come from a lived experience. Not all of them, some of them are actually qualified health professionals but would rather work in a health coach role. So a health coach actually helps with almost anything other than the health issues. Yep, they certainly support and understand what the GP has actually said to them about treatments, medications, that sort of thing, but they're really about, so what else, what matters to you most at the moment? For some people it's about their housing, problems with winds, problem with their kids, could be anything, helping to, I suppose, navigate, is the way you could word that.
Do they go out to the community and see people, or is it all done in...
They come through practices.
Yeah.
Okay, so the ideal way that it works, and it does work this way in some practices, is what they call a warm handover. So the health coach is actually on site in the practice. So they've seen the GP, and the GP's listened to it and said, when the patient has shared with them of other things, and if the GP's done their interviewing right, they'll find out what other things are on top at the moment that the GP, yeah? So look, we've got Janine down the road here, we're just down the corridor, she's a health coach, she can help you with some of that. So the GP literally takes the patient to that, introduces them and does that handover. And from there the health coach could very well take them out into the community, whatever helps. So I said, look, every time I go into WINS I have real problems and I get anxiety, and we'll go with them. The health coach will actually go with them.
Yeah, I wondered whether that was, I've got a friend who had a son and told him that his had significant depression issues, and somebody actually came to the house and helped set up a structure for his day. So I wondered if that was a similar type
Yep.
of role.
Absolutely.
Really good. I was quite impressed actually. I've never seen anything like that done.
Well, when I first started working for what is now Tamaki Health in Otara, is I suppose the genesis of what's now become the health coach, one of the pilots, is that when the referral was made by the GP because they had identified their patient had some mental health and or addiction issues, that we would contact the person, sort of say, look, this is who we are, this is what we can provide, when would you like to meet and where would you like to meet? And when we said, look, we're happy to come to your home, I would think 9 out of 10 people said, would you really? I mean, they thought the days of home visits were a thing of the past. Yeah, exactly. And the great thing about that is that you go to their home, you can see, I won't say how they're living, because it's not with a critical eye or a judgment eye, but particularly, and you can, with Pacific Island communities, generally they're very colourful, there's leis and there's great photographs of people, there's some great conversation starters there. And so so that really helps. So it's really when and where works best for them rather than them trying to fit into my schedule. Happy to answer any more questions or clarification or anything that sounded like double Dutch. Kia ora. That's a good point. I actually don't know where the nearest health care homes practice is to where I live. I've never asked Amajit that question. And look, because I'm quite assertive now, as a patient and know the questions to ask, I don't really have a problem. But if somebody came to me and said, look, I'd really like to, you know, I've just come into the area, I'd like to go into a practice, what's your one like? I'd say, well, okay, this is what my experience is, but I'd probably try and help them find somewhere else. It's not a bad practice, don't get me wrong. They're good people, the receptionists are good people, the doctors are really good. It's just that personal stuff that just seems to be a bit distant, really. But I will find out where my nearest healthcare homes practice is, because I'm sure in West Auckland there's got to be at least one. Or is there anybody here from West Auckland in a healthcare homes practice? Ah, no, damn it. Okay. Sorry, yes.
I just wanted to thank you for sharing your story. You don't know who all of us are.
I probably don't know anybody in the room, but somebody might come up and say later on, I've seen you before. Yeah.
So I want to just acknowledge that that's a very brave thing to do. And it, certainly from my perspective, and I'm sure from everyone in the room, it's very, very much appreciated.
Thank you very much. It's really appreciated you saying that. Thank you. Yeah. I presume, like any employee, yes, they agree to a police, whatever it's called, police report. So exactly the same as any employee. Absolutely. Yep. Thank you very much.